Hello, my name is Georgia Delgado and today I'm gonna talk about hormone therapy for postmenopausal women. Let's start with the definition. What is the menopause? Menopause is the time in a woman's life when her period stops. It usually occurs naturally, most often after age of 45. Menopause happens because the woman's ovaries stop producing the hormones estrogen and progesterone. Symptoms. Changes and symptoms can start several years early. They include a change in period, shorter or longer, lighter or heavy with more or less time between, hot flashes or night sweats, trouble sleeping, vaginal dryness, mood swings, trouble focusing, less hair on head, more on face. Understanding menopause.
Probably heard the terms perimenopause or menopause, but what exactly do they mean? Perimenopause begins in the years prior to menopause, when your hormones begin to change and your periods become irregular. This often begins when you're in your 40s. Menopause is defined as the time when there has been no periods for a full year, which for many women happens around age 51. How do you know you're in perimenopause? For many women, one common symptom is hot flashes. In fact, nearly 8 out of 10 women experience them. You may also notice other symptoms. Changes in your periods, such as irregular bleeding, mood swings, problems sleeping, and vaginal dryness. What can you do if you're bothered by these symptoms? My patients find that losing weight, being physically active, and eating healthy can help. Take time to breathe deeply, dress in layers, and avoid things that can trigger hot flashes, such as caffeine, alcohol, or spicy food. Hormone replacement therapy, or HRT, is no longer routinely prescribed, but is available. Talk to your doctor about its pros and cons. What about herbs or natural medicines? They may help, but studies are contradictory, so talk to your doctor first. Remember that menopause is a natural transition. For many women, this is a positive and important time to celebrate. You're not alone in this journey. Find support by talking to other women, family members, and your doctor. We have online tools, articles, videos, and photo stories to help you.
Applications in medicine. Hormone therapy reduces menopausal symptoms.
Hormones like estrogen and progesterone are chemicals produced by glands in the body. In our simplified illustration, we are using circles for estrogen and squares for progesterone. Normally, these hormones help regulate body cycles like menstruation. However, as we discussed in subchapter 3.1, Growth of Cancer, sometimes these same hormones can cause cancer to grow. The pathologist will perform tests on the cancer cells to determine if they have receptors that feed on estrogen or progesterone, stimulating their growth. If the cancer cells have these receptors, your doctor may recommend hormone therapy drugs such as blockers or inhibitors. Both types of drugs help to destroy cancer cells by cutting off their supply of hormones. The most common hormone therapy drug is tamoxifen. It blocks the estrogen-shaped openings in the cells, preventing estrogen-fueled cancers from growing. Tamoxifen can be taken as a pill on a daily basis, up to 5 years after surgery. Hormone inhibitors also target cancer cells with hormone receptors. But unlike hormone blockers, they work by reducing the body's hormone production. When cancer cells are cut off from the food supply, in this case estrogen, the tumor begins to starve and die. However, hormone inhibitors are only used in postmenopausal women. Generally, the benefits of using hormone therapy and chemotherapy together have a much greater combined effect than using either alone. If your cancer is positive for hormone receptors, your doctor may recommend both therapies.
purpose, hormone therapy is the most effective treatment for menopausal symptoms such as hot flashes and vagina dryness. If women have only vagina dryness or discomfort with intercourse, they prefer treatments are low doses of vaginal estrogen.
Hormone therapy is often used to ease symptoms like hot flashes in postmenopausal women. But this practice may have another benefit. I'm Shelby Cullinan with your latest health news. A new study found that women who continuously took estrogen plus progestin after menopause had a lower risk of developing endometrial cancer, or cancer that starts in the inner lining of the uterus. Estrogen and progestin are two female sex hormones, increase the risk for osteoporosis. Speak to your doctor about whether hormone therapy is right for you.
Key facts. In a large population studies, estrogen therapy applied to the skin and low-dose estrogen pills approved by the United States Food and Drug Administration have been associated with lower risk of blood clots and strokes than a standard dose of estrogen pills, but studies directly comparing oral and transdermal hormone therapy have been not done. Pros and cons. Benefits. Hot flashes generally require a higher dose of estrogen therapy that will have an effect on the entire body. Women who still have a uterus need to take a progesterone along with the estrogen to prevent cancer of uterus. 5 years or less is usually the recommended duration of the use of this combined treatment, but the length of the time can be individualized for each woman. Risk. Both estrogen therapy and estrogen with progesterone therapy increase the risk of blood clots in the legs and lungs, similar to birth control pills, patches, and rings. Although the risk of blood clots and stroke increase with either type of hormone therapy, the risk is rare in the 50 to 59 age group. An increased risk in the breast cancer is seen with 5 or more years of continuous estrogen progesterone therapy possible early. The risk decreases after hormone therapy is stopped. Is it safe?
There has been studies done since the last study that was performed in 2008. Yes, the postmenopausal hormonal therapy can be safe if it's used properly and managed properly. For patients that are a candidate, this can change and alter their lifestyle. Postmenopausal women do suffer from these syndromes and symptoms of lack of hormone. We strongly suggest to seek doctor's advice and use anything from holistic that we have in our hands to medical therapy that can be completely safe. These medications can alter their life so that they don't have to suffer for the rest of their lives.
Issue applied in Ecuador. Hormone therapy for the management of the menopause in Ecuador, perception, use, and knowledge among middle-aged women. Objectives: to obtain information regarding menopausal hormone therapy, use perception, level, and source of knowledge, and to determine factors affecting several of the issues among middle-aged women of Guayaquil, Ecuador. Design: a total of 349 women nursing staff aged 40 years or more were included in the present cross-sectional study. Participants completed a structural questionnaire including details related to hormone therapy and the reason for not using it, as well as demographic and physiosocial data. Results: only 50% of women considered hormone therapy beneficial. Current and former hormone therapy use was low, 1.7% and 14 and 3% respectively. Women responded that the main reason for not using hormone therapy were being asymptomatic, 49%, non-established menopause 30%, and physicians advised 20%. Conclusion: when all potential possibilities are considered, every woman should keep in mind what is their best interest both physically and emotionally as they go through menopause. Hormone therapy is most beneficial for women with symptomatic hot flashes or night sweats who are 1. Younger than 60 years old, or 2. Within 10 years old of the onset of menopause. Strategy. Why should postmenopausal women be treated for endometriosis?
I have women who are 60, 70, 80-year-old who are having similar symptoms of bloatedness, gassiness, tenderness, and when you do an exam, they are in a lot of pain. Their tests are negative. In those women, when you go back and ask them, 90% of them, and many of them are going to say, I used to have cramping periods all my life. I have had pain all my life, and nobody really thought there was anything wrong. Now there are studies which are coming out which are showing that there is a significant increase in risk of ovarian cancer in these women with endometriosis. So when you have these women with endometriosis and chronic pelvic pain, even when they are older and their tests are negative, when I have put in a camera and if they have needed a hysterectomy, 20 to 30 times a year, I find precancerous ovarian disease. And so it is not just a quality of life, it is so important to prevent ovarian cancer, but more than that, when we do these tests, we are giving these women a quality of life. They can have their marriages and their relationships back because they're not in pain all the time.
Thank you.